So sinus issues can be really debilitating and awful. If you feel like your sinuses are clogged, there's a few things I do with my patients that I can easily teach you. So one of them, I'm going to lay down and show you because I always do them when I'm in bed. That's where it feels best to me. And the first thing you do is you take one hand and you put it on the base of your skull. So at the top of your neck, you just right at the base of your skull, and your other hand on your forehead. So you just very slightly grip both, and what you want to imagine is pulling them apart. So your hands are like magnets and you're pulling your skull backwards in the back, and that's called the occiput, frontwards in the front on the frontal bone. So you're literally trying to pull your frontal bone off, and it feels really good, but it's gentle. You don't have to do much. Remember, more is not better. See, that's already making me feel better. Okay, so after that, this one's a little trickier. These right here are called the zygomatic arches. You put your hand on the zygomatic arches, just like the cheekbones, and then the other hand on the frontal bone. And then you do the same thing, you pull forward with both. And you just pull forward, forward, forward. And then you can do that for as long as you want. And then finally, you want to do what I call as a shearing. So you bring, if I exaggerate, you bring one side and one the other, and you hold it, and you bring it back the other way. So I'll demonstrate that. So you go one way, and you see I'm not using much pressure, and then hold it. And you'll notice that one way is probably a little bit more restricted, and that's okay. Just gently push it, and then hold it. You might feel a natural rhythm where it wants to release back to the other side, and hold it. You might hear a little bit of crackling as your sinuses open up, and hold it. And then you can end with pulling up again, away from your body. So exaggerating is like this. Now that just feels amazing. You can end it with just doing a little lymphatic work where you can just gently rub around your nose. You have a big sinus here, sinuses here, you can rub it there, always away from midline. And then even there's little points all along here you can use, but that's how to do it.